So annually, the Institute of Health and Metrics and Evaluation, they are based in the US, and even WHO, they developed the global burden of disease estimate. So what is the burden of disease attributable to air pollution in all geographical regions of the world? And this is informed by the integrated exposure response function. I mean, simply just those response functions. But the development of these functions rely largely on data from North America and Western Europe because we don't have data in Sub-Saharan Africa. And yet, this is used to generate estimates from Africa. So definitely, it has very limited applications in Sub-Saharan Africa. And the more reason why we need to get epidemiological evidence from Africa. So possibly we could leverage low-cost sensors to help us achieve these problems that we are faced. And just apps and Coca and things have highlighted all these things. Especially, Josh says that the inhale intake fraction of air pollutants among sub-Saharan populations is higher compared to what we witness in North Africa, North America, Europe, and Western Asia population. So therefore, then it's imperative that we get data from Africa. There are also varying differences in air pollution sources, and some of the sources I've already shown in my slide. So how reliable are the GBD estimates for Sub-Saharan African region? I've already talked about that, but this was a paper that was published by Hefnel in Nature. And if you look at the data that they collected and their estimation, you could see that their exposure response function is more elevated than what the GBD provides, So the GBD here, the integrated exposure response function, which is based on data from North America and Europe, whereas they collected data in Africa, and then this is what they found. So it further adds to the need for us to bring in more evidence from Africa. And these are some of the strengths of low-cost sensor technologies, and these are more, I don't want to bore you with this. In the course of the week, some of these things have been brought to the fore and to your attention. But what I want to highlight is that for us epidemiologists, it enables us to do something we call ubiquitous monitoring. That is, these sensors are cheap. You can place a number of them at several places. So we can have very fine measurement of air pollution. And if we are able to have very fine measurement, then it enables us to better quantify exposure and then overcome something we call exposure misclassification, which is the bane of air pollution epidemiological studies. The question is, why can we not leverage satellite remote sensing data? Why? Again, they have their limitations. One of the main things is that the overpass is 1 hour. In the 24 hours, the overpass is 1 hour. So how reliable are these estimates? Again, I'm sure these things will be highlighted in the lectures during the week, so I don't want to go too much into details, except to say that the overpass is 1 hour, and then again, that is problematic. So in 2019, I established this project that we call the Ghana Urban Air Quality Project. And the goal was to deploy a mixture of low-cost sensors and reference-grade monitors in Accra and other metropolitan areas of Ghana to bridge the air quality data gap and also to conduct epidemiologic research. And I must indicate that we started this project from our pocket, and then also through the benevolence of some individuals that donated sensors to our people like David Jack of Columbia University, gave us a number of purple air sensors and even a clarity node, which is still functioning in Kumasi, to start this project. And this project anchors the Breathe Accra project, which is funded generously by the Clean Air Fund. So we made a proposal to Clean Air Fund when they wanted to have a presence in Ghana. Now listen, if you can fund a project where we can continue to deploy these sensors and then also build some capacity, then of course we're going to revolutionize the air quality landscape in Accra, Ghana, and then by extension other African countries. But let me highlight that critical to implementation and success of this project is that we are doing everything in close collaboration with the regulatory authorities. So we have a close collaboration and working relationship with Ghana EPA, the Ghana Health Service, and the city authorities. And not until Emmanuel, Mr. Apple stepped down, I mean, he can attest to the collaboration that we have together. And I'm sure that collaboration is what has earned me this platform to come and also speak about this project. So what then is the context for establishing the Breathe Accra project? So Accra, where you find yourself now, has failed to act on the growing air pollution problems. And this is in spite of the fact that Ghana EPA in 2018 were supported to develop an air quality management plan. I think US EPA supported them to develop an air quality management plan. So if we have an air quality management plan, why have we still not been able to act on the problem? The reasons are threefold, in my estimation. One, there's lack of reliable data on air pollution levels in the city due to the limited monitoring capacity that I have highlighted. Two, there is also absence of local evidence on air pollution health effects. And this is very critical to increase investment in air pollution control, as well as building strong partnerships to address the problem. Then also there is lack of capacity at assemblies. I must indicate that this air quality management plan and the air quality program in Ghana or in Accra is centralized. So it sits in the Ghana EP with very little involvement of the assemblies. Indeed, there is an act that is being developed that will change the narrative. So assemblies have no clue about the air pollution problem. They don't also have the capacities, even though there are opportunities that exist in the assemblies. And I'm going to identify those opportunities shortly. So presently, for real-time data, Accra has two reference grade monitors. One is sitting at University of Ghana, where you find the Allison's lab at University at the Department of Physics, and you have one at Adabraka. And even this, it was with the support of, is it USEP or WHO to procure this? I mean, which will come to a level where government will be able to also procure these things without support from donors, but I'm sure we'll get there. Then, as I've already indicated, that the municipal authorities have no role in the monitoring program, but that narrative will soon change because an art is being promulgated and that will change that narrative. However, there are opportunities. There are opportunities in the municipal assemblies, and these are the opportunities that we have leveraged to implement this Breathe Accra project. We have Department of Development Planning, we have Department of Fiscal Planning, we have Department of Environmental Health, and these should be leveraged to improve air quality in the city. And these are the opportunities that we have tapped in to implement wholesale implementation of the Breathe Accra project. So the vision is to accelerate air quality improvement in Accra to help protect public health and also help inspire greater action on air pollution in other African cities. So one of the deliverables of this project is to have a blueprint. We need to document all the best practices and lessons learned so that we can share with other African cities for them to also replicate this under the Breathe Global Project, which is being funded by Bloomberg, Michael Bloomberg. I think $31 million have gone into that project. What we seek to do is to have an openly accessible hyperlocal air quality data in Accra. And we have developed a website, and I'll urge you to visit the website to see some of the nice things that we are doing. We are also trying to foster local capacity for monitoring and managing air quality, and we have undertaken a number of training workshops. I think three training workshops, and we still have some small workshops that are ongoing, trying to build capacity on sensitization for air pollution in communities. And then the last objective is that we want to have we have been asked to develop a blueprint so that we can share with other African cities to replicate the project. We have done a lot, but activities that we are undertaking so far is that we still have plans to deploy about 50 low-cost sensors. Already we have deployed about 40, 45. So we want to add in an additional 50 so that we're going to have about 100 low-cost sensors in the airspace, in the landscape of Accra. We have developed a web application which is hosting all the data from our project, And this enables access to air quality data in real time. So you go in there. So as you sit in Legon, you can go in there, you can put your location in there, and it will tell you the air quality levels around the location. We are also summarizing, we have a data manager who is summarizing the data on a daily basis, on a monthly basis, and posting it on the website. So you go on the website, you can see the monthly averages. We have trained environmental health officers, we have trained development planning officers, we have trained fiscal planning officers in the beneficiary district in air quality monitoring, implementation of the air quality management plan that EPA has, and then also how they can leverage the bylaws. The assemblies are sitting on tons of bylaws. Some of them directly and indirectly can impact air pollution. They don't know. We are identifying these to them. And then also policies that can help address the air pollution in their respective jurisdictions. This is the plan, the deployment plan. So if you look at this, this is a map of the old AMA. And here you can see that in each of the districts that are covered under the project, we plan to deploy about 5 sensors, a minimum of 5 in each of the districts in a central location. But the deployment is such that we have a sensor in the hospital, we have a sensor in the school, we have a sensor in a bus terminal or a lorry station. So we are looking at the mix or the dynamics of the district to guide deployment of the sensor. These are some of the sensors and then the reference monitor. So these are 2 of the TIOMs that we have. We have one at in Circle, which is central area of Accra. We have 1, 2 on AMA on top of City Hall. We are using Air Notes, and these are some of the Air Notes. We are also using Clarity Note, and these are some of the Clarity Notes that have been deployed in the Accra landscape. So we are using a mixture of Clarity Note, which is very, very expensive, and then also Air Note. The Air Note is cheaper, but of course it has its challenges, but we are managing it for now. So this is our website. So you go to the website, we have a page for historical data. We have, you see all the beneficiary districts. In real time, you can know the air quality where you are. Then ongoing activities. Like I said, we are deploying additional low-cost sensors. Presently, what we are doing is that we are engaging the assemblies to develop interventions to control air pollution in their respective jurisdictions. So we have a policy engagement officer who is interfacing with the assemblies, and then we are building their capacity in sensitization for air pollution. So each of the assemblies have a number of environmental health officers. So we are bringing all of them into a room and training them. We have developed a sensitization manual, which we are going to give to these environmental health officers to use in the training of, in the sensitization work that we want them to undertake. We are obviously collecting tons and tons of data, and as such, we want to do some prediction. We want to do some prediction, air pollution prediction models, some forecasting, and also try and develop some land use regression models for the city of Accra. And we are about to embark on a mobile monitoring campaign where we are seeking volunteers, which is taxi drivers, and then we are going to put the sensors, some of the sensors on the rooftop of the taxis, and as they drive around, we want to collect mobile monitoring data for a period of 1 year. And this mobile monitoring is funded under a project that, under a grant that we recently received from the NIH. So just quickly, what are some of the epidemiological studies that I have been involved in that has leveraged low-cost sensors? We were part of a project which was the Urban Health Initiative, which was initiated by WHO, I think about 4 years ago. And myself, Reginald, and others were tasked to contribute data to this.